Cleared to Play, where we take you inside the tent, get you updated on the latest injuries in the Bay. We are so proud to partner with UCSF Health on this segment and bring in our friend, Associate Professor of Orthopedic Surgery, Dr. Nirav Pandya. Hey, Doc, how we doing today?
I'm doing great. How are you guys doing after your golf outing?
Well, look, I won't speak for Dibs' back or knee or anything else. Body's feeling good. I'm very, very pleased, but, as always, we got to talk again in the morning when I wake up. But right now, we're looking good.
Awesome. Good to hear.
Yeah. So, but that's not the injury anybody cares about. Brock Purdy, full clearance on July 25th. Doc, what? That's not what we thought this was going to sound like.
I think a little bit in the semantics. I mean, I think they said, he's cleared for everything, but we're going to be ramping him up. And I think that at 4.5 months post-surgery, that's essentially what you're doing. You're like, look, you can start throwing, you can do everything, but how much you're doing in terms of back-to-backs and volume and intensity is typically how you're going to get him ready for that, hopefully starting the season. I do think it was a little bit early in terms of him letting to do everything at practice. But I think that maybe in a couple weeks, if this had happened, it wouldn't be as quick. But I think it really does demonstrate that with these UCL repairs, if you hit each of these benchmarks along the way, that you can be back even earlier than what a lot of people would expected. But I use the example of when Klay Thompson came back from his Achilles. His Achilles was healed, but they didn't let him go out and play 30, 35 minutes. We're really in that phase of, is Brock's body basically ready to handle all this intensity? They'll do it slowly, and then sounds like with 6 to 8 weeks left before the season starts that he'll be ready to go, which is not super surprising based we were all thinking it would be around 6 months.
So what is the ramp up like in terms of the next hurdles he has to clear? Is it being able to play 2 and 3 days in a row in practice? Is it facing contact? Is it all the above? What is he looking at in terms of the next things we should all look at as fans?
I think a lot of it's going to be when he does first throw, we're going to see how much is he throwing in practice. If he comes out and he's doing a normal number of repetitions, then really the big thing is going to be doing back-to-back-to-back practices without needing that day of rest, and that's going to be the next big step up. If you see him limiting how many throws he's doing, if you say, look, he's doing 10, 15 throws, then it's a combination of the volume and the back-to-backs. I think the contact is going to be the last thing that they pretty much clear him for, and that is where the biggest unknown is. There's lots of benchmarks in terms of motion, stability, where you're throwing, but there's no good data in terms of when that elbow is ready to get contact. We can assume 6 months because that's pretty much what we use for a lot of other things, but I think that's going to be the great unknown we don't know until he gets in the game, is how is he going to throw after that elbow gets hit.
Doc, I want to play for you something that we've listened to a few times that Steve Young said recently, and he said this to Matty Mayoko, 49ers Talk podcast, NBC Sports Bay Area, but he was talking about having a conversation with Purdy's surgeon and then made this comment. Take a listen.
One thing's for sure is that if it stays on track, there is a 6-month period to kind of get it full strength. And the thing that's unusual is that he does it for baseball all the time. He's done it 3 or 4 times for football, but not in the car wreck scenario, the way that he described, what happened to Brock. And so it's just, he says it's just not sure. And I think no one can know exactly how it's going to go. So if Brock is ready game 1, it's not going to be 100%. Anyone who says he can rip a pass 6 months later, I don't think it belies reality. It doesn't mean he can't play 90%. So we'll see how that goes. But if he's ready, I'm sure they'll play him.
Do you back that statement, especially now with today's news, that even on week 1, that Brock Purdy will definitely not be 100%?
I think he's going to be pretty close to it. And I think, the car wreck scenario actually bodes a little bit better for his ligament, because when you think about these pitchers or other quarterbacks who had it happen where it wasn't this one-time injury, that ligament is basically degenerated. It's torn. There's so much wear and tear in the joint. For all we know, Brock Purdy had a perfect elbow before this happened. So he's just dealing with this one-time injury. That ligament heals back in. He's got this internal brace. And pitchers start throwing pretty fully at 6 months, and there's less stress across that arm with a football throw at that 6-month mark. So I think he absolutely will be ready, given the fact that they're basically allowing him to do everything, just basically limiting how frequently he does it. I think he's going to be good to go based on what they're reporting today.
Well, the news is good today, and we still have another 6 or 7 weeks until the actual regular season, so we'll keep an eye on Brock Purdy. A little bit of scary news out of USC today, Doc, with Bronny James, LeBron's son, having needed medical emergent care because of cardiac arrest. What does this mean for his short-term and long-term ability to be healthy enough to maybe play basketball again.
I know, yeah. This is absolutely a very scary event whenever we're covering games. This is the one thing that you dread happening. ACLs, ankles, whatever, we can deal with that stuff, but this is obviously very scary. And they reported that it was a cardiac arrest, and I know everyone's kind of saying, is it a heart attack, is a cardiac arrest? And I think it's important to note a cardiac arrest is just when the heart rhythm, because of an electrical issue, just doesn't work. The key for him going back to sports is really what caused it. Was it some sort of congenital issue? Was it just some kind of off chance that his heart had a regular rhythm? So I think what the diagnosis that caused it's really going to determine whether he can go back and play. But if it's something big, if there's some huge congenital issue, this could impact his ability to play. We just don't know. But the good news is that in the short term, sounds like he's out of the ICU, you're kind of taking care of him. But it is definitely very scary. And until they figure out what happens, it's going to be hard. But I think it does emphasize once again that people can learn their CPR. They know where an AED is present. People can really save someone's lives. And it looks like whoever was there, the athletic training staff, were able to get him to the hospital in time, which is great.
No, it's critical, and it made me think about DeMar Hamlin, who has tweeted the family subsequently. How much does that play into maybe what we all understand now about these cardiac arrest episodes?
I think it totally plays a tremendous amount. I mean, I think that if you have that basic information and know that, look, you have a healthy young person that has this event where they fall down, you know where that AED is, you know where that CPR is, you can save someone's life. So I think everyone goes everywhere, what caused this, et cetera, et cetera. The key is we can save people's lives and potentially get them back to play, especially if there isn't a large congenital issue. So definitely very scary. Hopefully he's, number one, healthy, but number two, can get back on the court and we can see him playing for USC.
This is Cleared to Play. Doc Pandya joining us here, Willard and Dibs, 95.7 The Game. Doc, want to get a thought on the Giants as well. That knee issue for Brandon Crawford won't seem to go away. They're all kind of a mess up the middle, and so that is a concern because they don't seem to have an exact timetable. What do you think he's facing the rest of the way here?
Yeah, I mean, I think anytime you get to his age, you've kind of had off and on knee issues. I think he had some of this last season as well, too. You just get worried about, is there enough wear and tear and degeneration in there where you're just basically trying to get the knee through the season? Are you taking time off? Are you getting injections? But it's troublesome, particularly at the position that he plays. That knee is going to get stressed. So can the team almost manage this soreness, have him play for a period of time, have him rest? But it's problematic at this age, especially when there's not like a discrete diagnosis, like he had a meniscus tear and it needs to get fixed. It's just generalized wear and tear. And whenever you hear inflammation in a player over 35, you get worried if this is going to be something that's going to continue to be an issue season after season, game after game.
All right. Biggest issue of all, Doc. I mean, if Brock Purdy's cleared and just playing football, what the heck are we going to do when we talk to you each week? If we can't talk about Brock Purdy, what do we do?
There's nothing to talk about. I don't know. We can just, we can always talk about Kevon Looney.
Yeah, we can always say that he's playing basketball tonight, even if he's not. We don't even care. That's fine. Doc, great to have you, man. Thanks always.
No problem. Take care, guys.
Okay, there goes Doc Pandya, and the proceeding was sponsored by UCSF Health.